Today we're diving into an essential topic: pancreatic disease. Being able to recognize the early signs of pancreatic disease can make a huge difference in getting timely treatment and improving outcomes. Understanding these early signs is incredibly important. Often these symptoms are subtle and can easily be mistaken for less severe health issues. Make sure you stick around for the entire video, because the sign at number 9 is very common, and everyone ignores it in the start. Let's get started and empower ourselves with knowledge that could potentially save lives. Fatigue is a common yet often overlooked sign of pancreatic disease. We all feel tired sometimes, especially after a long day or a sleepless night. However, persistent fatigue that doesn't go away despite rest can be a red flag. This fatigue is often due to the body's inability to digest food and absorb nutrients. Patients with pancreatic disease may experience constant tiredness. It's a deep, unshakable fatigue that affects daily activities. This can be an early sign that something is wrong with your pancreas. If you're constantly fatigued without a clear reason, consult a healthcare professional. However, if you find yourself consistently disinterested in food and experiencing other symptoms like weight loss or fatigue, it's important to consider the possibility of an underlying pancreatic issue. Don't ignore a persistent loss of appetite. It's essential to talk to your doctor if you experience this symptom, especially if it's accompanied by other signs of pancreatic disease. Early detection and treatment can make a significant difference in your health outcomes. Persistent abdominal pain is a significant indicator of pancreatic disease. This pain is usually located in the upper abdomen and can radiate to the back. This type of pain can be a sign that the pancreas is inflamed or affected by disease. It's important to pay attention to the nature and duration of your abdominal pain. If it's persistent and doesn't improve with over-the-counter medications, it's essential to seek medical advice. This pain can be a sign of a serious underlying issue that requires prompt attention. If you experience persistent abdominal pain, especially if it's accompanied by other symptoms like fatigue, jaundice, or changes in bowel habits, it's crucial to see a healthcare professional. Early detection and treatment of pancreatic disease can improve your prognosis and prevent further complications. Dark urine can be a sign of pancreatic disease. Normally, urine color varies from light yellow to dark amber. Persistent dark urine could indicate a pancreatic issue. This is often related to jaundice caused by excess bilirubin. A blocked bile duct can lead to bilirubin buildup. This makes the urine appear darker. Pay attention to urine color changes and seek medical advice. Pale stools are another significant indicator that something might be wrong with your pancreas. Normally, bile produced by the liver gives stools their brown color. If the bile duct is blocked, or if bile production is disrupted, it can result in pale or clay-colored stools. This can be a sign that the pancreas is not functioning as it should. When your stools are consistently pale, it indicates that there might be a blockage in the bile duct or other issues with bile production, often linked to pancreatic disease. This symptom is crucial because it points directly to a potential problem with your digestive system. Ignoring this sign can lead to more severe complications down the road. If you notice a persistent change in the color of your stools, it's essential to consult a healthcare professional. They can perform the necessary tests to determine the cause and provide appropriate treatment options. Back pain is a symptom that many people might not immediately associate with pancreatic disease, but it can be a telling sign. The pancreas is located deep in the abdomen, and when it becomes inflamed or affected by disease, the pain can radiate to the back. This pain is often persistent and can be felt in the upper middle or upper left regions of the back. It's important to differentiate this type of pain from other common causes of back pain, such as muscle strain or spinal issues. Pancreatic-related back pain is usually deep, dull, and unrelenting, and it doesn't improve with typical back pain treatments like rest or over-the-counter painkillers. If you experience this kind of back pain, especially when accompanied by other symptoms like fatigue or changes in bowel habits, it's essential to seek medical attention. Early detection of pancreatic issues can lead to more effective treatment and better outcomes. Indigestion is a common issue that many people experience from time to time, but persistent indigestion can be a sign of pancreatic disease. Indigestion, also known as dyspepsia, can include symptoms like bloating, nausea, and a feeling of fullness after eating only a small amount of food. When the pancreas is not functioning properly, it can affect the digestive process, leading to these uncomfortable symptoms. chronic indigestion can be particularly troublesome and can significantly impact one's quality of life. It's important to note that while indigestion can have many causes, persistent or severe indigestion should not be ignored. It could be a sign that your pancreas is struggling to produce the necessary enzymes for digestion. If you find yourself frequently dealing with indigestion, it's a good idea to talk to your doctor. They can perform tests to determine the underlying cause and help you find relief. Early intervention can prevent more serious complications. New-onset diabetes or worsening diabetes symptoms can be an early sign of pancreatic disease. The pancreas plays a crucial role in regulating blood sugar levels by producing insulin. When the pancreas is affected by disease, it can disrupt insulin production, leading to diabetes. This is particularly concerning if you have no prior history of diabetes, or if your blood sugar levels suddenly become more difficult to control. Common symptoms of diabetes include increased thirst, frequent urination, and unexplained weight loss. If you notice these symptoms, especially if they appear suddenly, it's important to consider the possibility of an underlying pancreatic issue. Early detection and management of diabetes can significantly improve your long-term health outcomes. If you experience these symptoms, make an appointment with your healthcare provider to discuss your concerns and get appropriate testing. Unexplained weight loss is a symptom that should never be ignored, as it can be a sign of pancreatic disease. When the pancreas is not functioning properly, it can affect the body's ability to digest and absorb nutrients, leading to significant weight loss. This weight loss is often rapid and occurs without any changes in diet or exercise. It's important to pay attention to your body and notice if you're losing weight without trying. This could be a sign that your pancreas is not producing enough digestive enzymes, which are necessary for breaking down food and absorbing nutrients. If you experience unexplained weight loss, it's crucial to seek medical advice. Your doctor can perform tests to determine the underlying cause and provide appropriate treatment. Early detection of pancreatic disease can lead to better outcomes and prevent further complications. Jaundice, characterized by yellowing of the skin and eyes, is a classic sign of pancreatic disease. This symptom occurs when there is a buildup of bilirubin in the blood, often due to a blockage in the bile duct. The pancreas is closely connected to the bile duct, and when it's affected by disease, it can cause this blockage, leading to jaundice. Jaundice is a symptom that should never be ignored, as it indicates a serious underlying issue. Besides the yellowing of the skin and eyes, jaundice can also cause dark urine and pale stools, as previously mentioned. These symptoms together can provide a clearer picture of a potential pancreatic problem. If you notice any signs of jaundice, it's essential to seek medical attention immediately. Your doctor can perform tests to determine the cause and provide appropriate treatment. Early intervention can prevent more serious complications and improve your overall health. Loss of appetite is a common but often ignored sign of pancreatic disease. Many people experience changes in their appetite from time to time, but a persistent lack of appetite can be a red flag. When the pancreas is not functioning properly, it can affect the digestive process, leading to a decreased desire to eat. Persistent abdominal pain is a common early sign of pancreatic disease. It often starts in the upper abdomen and can radiate to your back. This deep, gnawing discomfort doesn't go away with over-the-counter pain relievers. Consult a healthcare professional if pain persists. The pancreas is located deep in the abdomen. Inflammation or tumors can press on nearby organs, causing pain. Ignoring the symptom can delay diagnosis and treatment. Another alarming sign of pancreatic disease is jaundice. Jaundice is characterized by a yellowing of the skin and the whites of the eyes. When there's a blockage in the bile duct, bilirubin accumulates in the body. You might also notice dark urine and pale stools. Seek medical attention immediately if you notice these signs. Unexplained weight loss is another significant sign of pancreatic disease. The pancreas plays a crucial role in digestion by producing enzymes that help break down food. When the pancreas is not functioning properly, your body can't absorb nutrients effectively, leading to weight loss. Weight loss can be particularly concerning because it often goes unnoticed until a significant amount of weight has been lost. You might attribute it to stress, diet changes, or increased physical activity, but if you haven't made any lifestyle changes, it's time to pay attention. Moreover, weight loss can be accompanied by other symptoms like fatigue and loss of appetite, which we'll discuss in the next chapters. If you're experiencing unexplained weight loss, it's essential to consult a healthcare professional for a thorough evaluation. Early diagnosis can make a significant difference in treatment outcomes. A sudden loss of appetite can be an early warning sign of pancreatic disease. If you find that you're no longer interested in food or feel full quickly after eating a small amount, it could be a symptom worth noting. The pancreas is involved in producing enzymes that aid in digestion, and when it's not functioning correctly, it can lead to a decrease in appetite. Loss of appetite can be subtle and easy to overlook, especially if you're busy or stressed. However, when combined with other symptoms like weight loss and fatigue, it becomes a more significant indicator of underlying issues. You might notice that you skip meals or feel nauseous at the thought of food. It's essential to listen to your body and recognize when something is off. If you experience a persistent loss of appetite, it's time to consult a healthcare professional. Early intervention can help identify the root cause and lead to more effective treatment. Frequent nausea is another symptom that can be linked to pancreatic disease. If you find yourself feeling nauseous regularly, especially after meals, it could be a sign that your pancreas is not functioning correctly. The pancreas produces enzymes that help break down food, and when it's not doing its job, it can lead to digestive issues like nausea. Nausea can be particularly bothersome because it affects your overall quality of life. You might find it challenging to enjoy meals or even go about your daily activities. It's easy to dismiss nausea as a minor issue, but when it becomes a regular occurrence, it's worth paying attention to. In some cases, nausea can be accompanied by vomiting, which we'll discuss in the next chapter. If you're experiencing frequent nausea, it's essential to consult a healthcare professional for a thorough evaluation. Early diagnosis can lead to more effective treatment and a better quality of life. Vomiting is another significant symptom of pancreatic disease. If you find yourself vomiting frequently, especially after meals, it could be a sign that your pancreas is not functioning correctly. The pancreas produces enzymes that help break down food, and when it's not doing its job, it can lead to digestive issues like vomiting. Vomiting can be particularly concerning because it can lead to dehydration and other complications. It's easy to dismiss vomiting as a minor issue, but when it becomes a regular occurrence, it's worth paying attention to. You might notice that you vomit after eating certain foods, or that you have difficulty keeping food down. If you're experiencing frequent vomiting, it's essential to consult a healthcare professional for a thorough evaluation. Early diagnosis can lead to more effective treatment and a better quality of life. Remember, vomiting is your body's way of telling you that something is wrong. Chronic fatigue is another symptom that can be linked to pancreatic disease. If you find yourself feeling tired all the time, even after a good night's sleep, it could be a sign that your pancreas is not functioning correctly. The pancreas plays a crucial role in digestion and blood sugar regulation, and when it's not doing its job, it can lead to fatigue. Fatigue can be particularly bothersome because it affects your overall quality of life. You might find it challenging to go about your daily activities or even get out of bed in the morning. It's easy to dismiss fatigue as a minor issue, but when it becomes a regular occurrence, it's worth paying attention to. If you're experiencing chronic fatigue, it's essential to consult a healthcare professional for a thorough evaluation. Early diagnosis can lead to more effective treatment and a better quality of life. Remember, fatigue is your body's way of telling you that something is wrong. Changes in stool color or consistency can be another sign of pancreatic disease. If you notice that your stools are pale, greasy, or foul-smelling, it could be a sign that your pancreas is not functioning correctly. The pancreas produces enzymes that help break down food, and when it's not doing its job, it can lead to changes in stool. Changes in stool can be particularly concerning because they can indicate that your body is not absorbing nutrients effectively. You might notice that your stools are floating or that you have difficulty flushing them. It's easy to dismiss changes in stool as a minor issue, but when it becomes a regular occurrence, it's worth paying attention to. If you're experiencing changes in stool, it's essential to consult a healthcare professional for a thorough evaluation. Early diagnosis can lead to more effective treatment and a better quality of life. Remember, changes in stool are your body's way of telling you that something is wrong. The sign at number 9 is very common and everyone ignores it in the start. Back pain is often overlooked as a sign of pancreatic disease, but it's a symptom that should not be ignored. If you find yourself experiencing persistent back pain, especially in the middle or upper back, it could be a sign that your pancreas is not functioning correctly. Back pain can be particularly concerning because it can be mistaken for other issues like muscle strain or arthritis. However, when it's persistent and doesn't go away with over-the-counter pain relievers, it's worth paying attention to. You might notice that the pain is worse after eating or that it radiates to your abdomen. If you're experiencing persistent back pain, it's essential to consult a healthcare professional for a thorough evaluation. Early diagnosis can lead to more effective treatment and a better quality of life. Remember, back pain is your body's way of telling you that something is wrong. Developing diabetes suddenly can be a sign of pancreatic issues. If you find yourself diagnosed with diabetes without any prior history or risk factors, it could be a sign that your pancreas is not functioning correctly. The pancreas plays a crucial role in regulating blood sugar levels, and when it's not doing its job, it can lead to diabetes. New-onset diabetes can be particularly concerning because it can indicate that your pancreas is not producing enough insulin. You might notice that your blood sugar levels are difficult to control, or that you experience symptoms like increased thirst and frequent urination. It's easy to dismiss new-onset diabetes as a minor issue, but when it becomes a regular occurrence, it's worth paying attention to. If you're experiencing new-onset diabetes, it's essential to consult a healthcare professional for a thorough evaluation. Early diagnosis can lead to more effective treatment and a better quality of life. Remember, new-onset diabetes is your body's way of telling you that something is wrong.